Welcome back to the final episode of the first season of Thinking About Therapy. In today's episode, I'm delighted to be joined by Dr Gail Wilson, a highly skilled and experienced counselling psychologist who joins me today to talk about anxiety. The format of today's episode is slightly different to previous episodes in that I've asked listeners to submit questions in relation to anxiety and what you would like to know. Based on that, some people will be more interested in particular questions than others, and in the episode show notes I've put the questions that we're answering and the times we're answering that, and that allows you to kind of skip forward to a particular part that might be of interest to you if you don't want to listen to the full episode. The topic of anxiety is so big and so broad, and we could take this in so many different directions, but for the purpose of today's podcast we've really just gone with the questions that have been asked. Maybe before we get into that, one of the best things to do is have a little bit of a discussion around anxiety and what we understand anxiety to be in terms of sort of anxiety that's experienced every day and kind of normal within the population compared to what we would call more clinical anxiety, chronic kind of severe anxiety, and starting off with that, and then we'll kind of get into the questions.
I don't know if you have any kind of thoughts in terms of what makes those different.
Sure, yeah, I suppose like we all feel anxious from time to time. Some of us will feel more anxious than others, and some of us will be more maybe predisposed to feeling anxious or to having anxious thinking styles. So I believe there's some heritability of more anxious traits. But the difference between, I suppose, us feeling anxious from time to time and a sort of more chronic or clinical level anxiety, there is a big difference, I think, in how people experience anxiety. So, for instance, we might experience feeling worried about or anxious about getting a score back from university or school, or worried about meeting someone for the first time, and we'll get a surge of anxious type experiences, which I think we'll kind of describe in more detail later on in terms of what people might consider symptoms of anxiety. Whereas someone with more clinical level anxiety may experience those same symptoms, if you like, but on a much more intense level and a much more consistent level. So it's likely to be daily for some people that they experience that level of intrusive thoughts, maybe worrying thoughts, what if thoughts, catastrophizing thoughts, feelings of like being out of control or fear, general sort of difficult emotional states. And then I guess that moves into behaviours, avoiding scenarios much more often, not wanting to engage in different social experiences, or really making your life very small, I would say. And and then the physiological state, I think it's particularly distressing and anxiety, or when we're feeling anxious, feeling sick constantly, nausea constantly, actually being physically sick. For instance, if you have anxiety about leaving the house, agoraphobia, you might actually physically be sick before leaving the house, forcing yourself to face that fear. Things like IBS are quite common, and when you've got greater levels of anxiety, insomnia can be a comorbid difficulty with more chronic levels of anxiety as well. So that's not to say that other people won't get these things from time to time, and that it's equally distressing in its own right, but there can be that separation of how often and how intense you might experience it. I don't know what you think. That's kind of a long-winded way maybe of talking about it.
I think that's a good way of putting it, because I think it is that, like, I suppose it's that kind of CBT way of understanding it in terms of like those intrusive thoughts, the worries, the physical sensations, and how it impacts like the physiology of our body as well, and the behaviours. And I think that's the thing that, just as you were talking about it there, I'm thinking, one of the significant things that I look for, which changes it from like just everyday anxiety that we do all experience to actually more clinical anxiety, is the impact that it's having on somebody's life.
Mm-hmm.
So that you mentioned there that like their world becomes a bit smaller. How much does it impact on that like day-to-day functioning? So they stop maybe going to work, or they don't want to leave the house at all, those kind of things. And when that persists over a long period of time, I suppose there's maybe those two things for me, like the impact that it has, and if it's doing that to you for a long time, then that's an indication that it's maybe more severe than that everyday anxiety that we talk about.
I think that's such a valid point, and a really important sort of distinctive factor that it is. It's about the functioning of your life, and then the almost like impairment caused, that you cannot do the things that you would ordinarily want to do. That, I guess, for instance, like if you have a group of like friends or family, what someone with more like, say, social phobia, they may experience an excessive amount of anxiety or around a situation of obviously going to a party or meeting someone new for the first time, or being around an authority figure, and fear judgment or scrutiny, or fear getting embarrassed in that kind of situation. Whereas, the majority of people in their friendship group or family group would be not experiencing that excessive level of fear over that kind of specific scenario. And I guess that then impacts that person's life much more than it would somebody else's, who maybe not get that, the sweating, the heart palpitations, the wanting to vomit, that kind of experience that, I'm really going to not do this, I need to cancel this. And that actually affects the quality of your life and stop you from having certain things or being with certain people because of the fear.
Yeah. One of the things, like whenever I was kind of saying to you about let's do a podcast episode on anxiety, is thinking about how often that term is used these days.
Yeah, absolutely.
And although a lot of I suppose it's that sense that, a lot of the stuff that we see online in relation to anxiety helps with your everyday anxiety as well. But there is a sort of more specialist treatment for somebody who is clinically anxious, whether it be in relation to a phobia, or social anxiety, sort of generalized anxiety, whichever it is. But just having a little bit of a chat around, actually, it's a term that's thrown out so much and used an awful lot, and kind of just getting a sense of what your thoughts are on that, or how do we, I suppose there's a little bit of me that says, like, how do we educate people about what the difference is, and actually sometimes using that so much, it's sort of I don't know if it takes away is the right terminology from the people who actually have more chronic or severe anxiety. And when we use it all the time, then it's hard to establish, well, when is it normal anxiety, like within the normal levels, or when is it actually more chronic and you need more help for it.
It makes me think of your first episode with Dean on OCD and his communicating that really well, in terms of people throwing about terms like OCD when actually, in a way, because they don't know what, most people are not going to know what the criteria for meeting, clinical levels of distress for various things are, of course, and we can't expect them to. But there is something about, I suppose, mental health education in schools and universities, the workplace. There's a lot of, I think, therapeutic input going into schools, but I don't know how much educational input is going. I mean, I don't work in education settings, so there may well be lots going on. It'd be great if there's any teachers out there, or that want to sort of write in or whatnot to let us know. But people that in my peers, I think there's definitely a level of not knowing that kind of thing, and so we do throw around terms of I'm depressed, or I'm feeling anxious, or my anxiety is just so horrendous, and it will be for you. I think that's something so important, validating that if you're using these terms, it's because you feel awful about something, and that's not to take away from that, but it, I suppose, is knowing that feeling anxious, having being in the state of anxiety, it will be for a short time period, likely, when it's something like we talked about earlier, like giving a solo talk, or making a public speech, or meeting someone, or for the first time, that kind of thing, and that will subside, you know, relatively quickly once you establish yourself in the situation. Actually, you realise this is not as bad as I thought it was. Whereas it's much harder to do that when you have a more intense feeling state. There's more fear around actually going through that process with someone with greater anxiety. So I don't really know whether that is just, you know, people like us having conversations around this to offer that into the world. Again, it's I don't think it's wrong that people use terms like anxiety or depression. I think it's just there is something about, you know, educating that you might be feeling anxious for a period of time. It doesn't necessarily mean that you have anxiety. And just language is so important. It's so important with mental health.
I wonder if that kind of ties into one of the questions that came in relation to if you kind of, once you've experienced like anxiety, and I imagine when they say that sense of that like clinical anxiety level, is it something that you can ever kind of live without? So can you go back to experiencing what we would, I don't know, I'm using the word normal, I don't know if I like that word, normal level of anxiety.
I know.
And I suppose I was thinking about that, is like, is that possible to go back to, you know, experiencing lower levels of anxiety once you've maybe had a period of very chronic anxiety? And I'm just kind of thinking out loud around that and thinking, I would say it probably is, but it would take an awful lot of work. And I suppose for me, the thing that I would find interesting is whenever you do experience like anxiety, and you know, as you said there, those kind of things like say going for an interview for a job, which is going to be naturally an anxiety provoking situation for anybody, that might re-trigger that sense of, oh, I wonder, is this me starting to become like clinically anxious again if this persists? So it might be very hard to separate those two
and
out.
I suppose something like that, something about like going like the workplace environment, does that become specific to something like a social phobia, or, you know, or because I'm thinking there about actually how is anxiety, what are the different kind of levels or descriptions of anxiety that would be, say, diagnosed. So if you go to your GP and then they refer you to, they either make a diagnosis, they refer you to the psychology or psychiatric services to get a diagnosis, or just to get some sort of intervention from various settings. We might have something like generalised anxiety, which you would need to, you know, you would get diagnosed with that unless you'd had pervasive symptoms of anxiety for 6 months. So, I mean, that's kind of, if we think about cut-off points, that's experiencing some sort of level of anxiety kind of on a daily basis, that not just situation specific. But then you'd have something like a phobia, which is a very specific anxiety. You'd have a very intense level of anxiety, but for one type of thing. So whether that's a needle phobia, social phobia, emetophobia, phobia of being sick, something like that, which you would get those symptoms around that very specifically. And then you've got things like panic disorder, or if you want to use the word disorder, which we could have many conversations around the merits and not merits of that. Things like post-traumatic stress being sort of an anxiety, stress-based difficulty, which can be diagnosed. Are there any things I've missed? There'll be lots of different, there's things like dissociative things that can be diagnosed as well. And
I think that's a really good way of actually, you know, thinking about it, even in terms of that kind of questions, like, can I ever live without it after I've had it, is probably very much dependent on the type of anxiety it is. Because, you know, even like I had a fear of dogs whenever I was younger. I don't have that fear anymore. So that sort of, I suppose that's evidence for like, okay, well, I can live my life without that fear. But something like PTSD or any kind of dissociative anxiety disorder, or even panic, I think sometimes, you know, perhaps that might be a little bit harder to kind of move on from afterwards.
And I think each of them is split, and there's different lifetime kind of prevalence rates for all of these things, and lots of people don't seek intervention and can go 20, 30, 40 years being having a generalised anxiety, but not knowing that that's what it is. And and I think there is, there's good evidence out there for things like CBT for like panic. I think the efficacy of treatment is something like 70 to 90%. That actually if you go through a treatment process or intervention that works for you, and there's lots of different types of intervention, therapeutic, medication that may help. Everyone's going to experience it differently to some extent and benefit from various treatments. And that's why it's helpful to speak to various different people and get an understanding, whether that's looking at NHS Inform websites, going to your GP, contacting a therapist or a psychologist, or whatever it may be that's going to work for you. There can be intervention that's going to work. But if you're a more anxious person generally, you maybe have a more anxious way of being and more anxious thought processing, we can't always take away something, but we help. The idea in psychology certainly is to give people the skills and the education so that they feel they can manage the difficulty better. And oftentimes that results in reduction or remission of symptoms completely, but not all the time. And it's going to be very person dependent.
Yeah, and I think that idea that actually, whenever somebody says, can I get over the anxiety, or can I live without it? We might not be able to live without it, but we might be able to live with it and use, psychology, or a mixture of psychology and medication, things like that, or whatever kind of interventions that you like to help you get it to a manageable level. And that doesn't mean always, in my mind, when I say that, it doesn't mean always having to go like to therapy. It might be that you take a break for a substantial period of time, but you notice that maybe, something stressful is happening, and that's going to cause your general, your anxiety to increase anyway, but you want a bit of support to make sure that it then doesn't become overly problematic for you. So dipping in and out whenever you need it. But I suppose it's that awareness and that recognition that actually that might be the best way for you to live with the anxiety, and it feel manageable for you in the long term, and I suppose that's all tied up for me in those kind of conversations around do people see therapy as a good thing or a bad thing in terms of if they always have to go. And even though sometimes we might work towards a certain number of sessions with people, that idea that actually, you can come back, and it's not a bad thing if you come back, and ideally we'll get you to come back before you get to more of a crisis stage, so we'll get you to come back earlier and work on it and manage it that way. So there's a whole kind of conversation around that in terms of how people think about it.
Because life happens and situations happens that we can't necessarily always prepare for. So if it rocks you in your world, then absolutely it can be really important to go and get more help. Something I was just thinking there when you were talking is I guess there's also setting out the context that if you're maybe in a situation that's evoking anxiety on a more sort of chronic basis, you might be in a violent relationship, you may be experiencing abuse, either in the past or present. I guess we're kind of thinking about present right now, and the rates of that are potentially increased because of COVID and people having to be in the house more. For us, just to bear in mind that actually some people's anxiety is going to be really great because of context that they're in, and that's not going to go away unless you're out of the context. And it's really important that people get help if they are in situations that are not acceptable and are abusive or neglectful in any kind of way.
I think that's really important, because actually a lot of people that we see with anxiety, it is largely due to their context. That has such a huge impact, as you said there, in terms of somebody who's in an abusive relationship, whether that's a domestic relationship or a child who's around a parent that's abusive, or a parent that's around a child that's abusive. There could be so many different ways, or even thinking about that's one way in which a context can cause your anxiety. If you're in a workplace that's, there's a lot of bullying, say, happening, or a lot of, even stress, that context is going to impact in terms of your anxiety. So yeah, really important to kind of look at that. And I suppose for me, that's where the kind of psychology part of it comes in, where we're going well, let's understand what's happening for you personally, but let's also understand what's happening in the world around you, so that we can see, what's kind of fueling that anxiety. and where we can and can't work with. And especially in situations where maybe somebody's in a relationship like that, then it's important that if they decide to remove themselves from that context, that they're supported to do that. And yeah, certainly that's something that I'll put some links into the show notes at the bottom around, because I think that's important, that people have access to that. We've kind of briefly mentioned there the different types of anxiety. And I suppose the most common ones I get questions around are kind of the generalized anxiety disorder or the social anxiety disorder. And we're going to talk a little bit, because some questions have come in with regards to the social anxiety, but those other ones are probably ones that I would kind of do specific episodes on. So today is sort of let's call it like an introduction to anxiety. Maybe based off of that, then if there's interest in kind of a specific episode in relation to the social anxiety, we can do something specific around that, or that generalized, or PTSD, or whatever it is. I suppose before we kind of get into maybe the specific ones around the social anxiety, because there was quite a few of those came in, is maybe thinking about that sort of how do people recognize those physical and mental symptoms of anxiety. And I think you've talked a bit about that at the start in terms of those kind of intrusive thoughts, worrying thoughts, the what if. Those are very much to me like some of the mental kind of signs, and the more physical ones, even as I said, you've described them in terms of that kind of heart rate, sweating. I suppose it's for us, we use that terminology of like that fight or flight response a lot, and other people sometimes hear that, but I don't know if people always understand what we mean by that whenever we use that. I don't know if there's anything in particular that you think of whenever we talk about the kind of physical and the mental symptoms.
Yeah, there can be so many, and I think that's what's difficult. And I think often people can be loath to think that it is anxiety, and it's just, I just have IBS, or I just get migraines, and that might be the case, but it's also worth looking at how do you feel when you're around certain people. What's work like for you actually, and being really curious about what's life like right now for me, what am I enjoying, what am I not enjoying. And that's not necessarily just about anxiety, there could be lots of things going on, but allowing yourself to be curious about what seems to be either it happens at certain times, or the month where maybe you have lots of meetings on, or whatever, but just being curious about what's going on in your day-to-day life that could be triggering.
Yeah, I think that's the thing, like with these symptoms, those kind of physical or mental symptoms of anxiety, they can also be very similar to lots of other things. And so it is that actually, speaking with somebody, or that reflection yourself, and as you said there, in terms of what, noticing what's happening for me, what is actually going on, and kind of getting a sense of, well, is that normal for me? Am I experiencing more migraines than I normally would, or as you said, even kind of tracking that around, like, right, well, do they happen at a particular, time? Is there a pattern here? It happens when I'm more stressed out, or and sometimes we don't always give ourselves permission to do that sort of reflection, to figure that out, because we're always like go. So trying to do that. I think again it goes back to what we were talking about earlier, that the main signs for me that it's an anxiety that has become problematic is the impact that it's having on your life.
Yes.
So if you're not the same way as with somebody who's like, somebody with depression often will say, there's these things that I do that I used to get enjoyment out of that I don't anymore. So looking for what are the things that you used to do that maybe you don't anymore, and is it because of your anxiety? Is it because you're too nervous to go do it? Do you get those butterflies, feeling sick, sweating, racing thoughts, those kind of things before you go do it? So that to me is the real kind of key thing in terms of the impact that it's maybe having. Are the signs that it's become a more problematic level of anxiety. And that's whenever I would be saying, go and speak to your GP, whoever your kind of healthcare professional is that you engage with the most. And you can do that, you can have that conversation much better with them, I think, when you've made that reflection yourself, in terms of, if you're able to kind of say, well, look, this is what I've noticed. This is, I'm getting a lot more migraines, or as you said, there are even family events and things like that. Normally I would maybe feel okay about going to them, but recently I've noticed that I want to try and avoid them. Avoidance, I suppose, is one of the key things that we see with anxiety, is really avoiding any sort of responsibility. And unfortunately what we see is it only impacts your anxiety even more, because a lot of the things that you avoid and put off kind of come back around again, you know, avoid opening letters and things like that.
Mm-hmm.
You know, even those smaller things that we see sometimes in people with anxiety, like that one of actually, I don't open my post. Because I don't want to see what it is that's coming in, or I don't want to, you know, I've got loads of messages from people but I haven't responded to any of them. Noticing those kind of things, and it might be that, you know, you're going through a stressful time or you've got a lot on, so you don't want to respond to all those text messages. That's okay, but if it's persistent and it keeps happening over and over again, then it's more problematic, and that's maybe when we would be saying, let's talk to somebody about that.
Yeah. And when you do have those conversations with professionals, and I think, you know, I was certainly using in my practice, you know, different questionnaires that help us to work out, is it generalized anxiety? Is it more social? Is it more phobic? You know, we have various tools at our disposal to use to help both of us understand, you know, what's going on here. And then we would typically, you know, try to create a collaborative understanding of what are the specific situations, what's happened in your past that it might be impacting you now, what triggers, what keeps it going. And as you said there, that avoidance is often key in anxiety, across the board, and anxiety difficulties of putting off the feared event or relation or whatever it may be. And that's a very understandable approach.
Yeah.
But as you said, yeah, we'll often make that worse because it builds and builds and builds, and we don't take the opportunity to learn that actually maybe the worst thing doesn't happen, or if it does, I survive it.
Yeah.
Or I can accept that this has happened and work out how on earth I feel about it and what I think about it, and continue to move on. It's that anxiety often keeps us stuck. I hear that word a lot, stuck. I feel so stuck. I feel small. I feel limited. I feel trapped. I feel out of control. And these are the horrendous things that are, you know, evolve with anxiety and worsen over time unless we do something to intervene. And there's lots of things that we can do personally or seeking out intervention that will help to move through all of these difficulties.
And actually, that's a really good point in terms of that, like the feeling stuck. And the other one that I often hear is, I feel stuck, but it also feels like it's so out of my control. You know, like anxiety, you know, for anybody before a job interview can feel so overwhelming that you feel like, okay, you know, this is like intolerable, but you know there'll be an end to it. So when you come out of the job interview, you might still be on a bit of a high, but it'll come down. And so there's that element of, okay, I know that it'll leave me, but whenever it's anxiety that feels like we don't know when it's going to end, that level of it being out of control, you know, feeling so out of your control, which often in turn then feeds the anxiety even more. But that, you know, recognizing I feel like I don't have control over this anymore, and that's part of that kind of the talking kind of therapy for me, is actually helping you see that you can get a little bit of control back onto that, and it can be manageable to sit with it.
Yeah, and I think what we've covered, I'm also aware that there was another question about would you maybe notice it in children as well. Mm-hmm. So even for us to maybe bring that in, because it can be similar, but children they may have even less resources to express themselves through, and maybe probably don't have a clue what's actually going on, but are really struggling. Yeah. So I think particularly, you know, to try and recognise it in somebody else or yourself. I think often like the physical experiences for anxiety really shine through for me when I'm, you know, assessing, you know, are they feeling nauseous? Do they have sore heads often? Are they, you know, particularly for children, if they're complaining about a sore head or complaining about feeling sick or complaining about difficulties going to the toilet, things like that. You know, to be just being, I suppose, watchful in a way of your child. And these are physical experiences that adults, teenagers, older adults will experience also with anxiety, particularly complaints about sickness and bowel movements. However difficult those can be to talk about, sometimes are a real clear, often indicator of something that's going on that's not the norm or might seem to come out of nowhere, and that can lead us, okay, well, let's sort of try and have a bit of a chat about it. But I think particularly with kids, it's best to do that in a scenario where you're active, you're doing something, you're not just pulling them down and saying, let's have a conversation, because that can be really intimidating, and you probably have the best intentions to have a conversation with your kid, but can, a child doesn't necessarily know what's going on, they just know that it's not okay. So to make it as lighthearted as possible, and just,
I think the important thing for me when thinking about the symptoms for children is that they're not necessarily massively different from what we experience ourselves as adults.
No.
But the significant ones are, for children, the sleep tends to be affected most, or not eating, or toilet, especially as a young child, if they're not able to regularly go to the toilet, or there's difficulties in toileting. But otherwise, those kind of things like, feeling a bit sick, feeling really angry, very emotional, all those things are all really the same as what we experience in children just experience. It's maybe the difference is that children don't always have the language, to talk about, particularly younger children. It sounds very silly, but I often say to parents, watch Inside Out with your child. It's a really good film. It's a really good way of helping a child understand those different emotions that we have. And sometimes it gives parents and children a shared language that you can use, or trying to help a child recognize with some of the identify with some of the characters in the film, as a way of talking about it. I think as parents, the best thing people can do to help is try to talk to children about it, is try and have that relationship that allows you to talk about those emotions. And if you feel like that you don't have that, or that your child won't talk to you particularly, and that's quite often the case in kind of older children or teenagers, is offering the right support for them, recognizing that actually they might not want to talk to you about some things and they need to talk to somebody else. And I think it's not parents' responsibility always to do that. That's where schools and things like that are all, and we're in a position now, probably more so than ever, where we have more therapeutic input in schools, probably not as much as we should, but we do have some, reaching out to the school and asking them if they have any supports. Again, just like the same as adults, going to your GP, ideally we would say do it with, your child, so that they're involved in the process. But if you're concerned as a parent, then go and speak to your GP. They'll have, an awareness of community, maybe organizations that can support, or like therapists that specifically work with children in the community. But I suppose the main thing I would be saying is the symptoms aren't massively different to what we experience as adults. It's just about the age of the child and how well able they are to communicate.
I wonder a little bit about, and can be quite a sensitive topic, but as parents being aware of how do I manage my emotions, and sometimes it's not linked at all, but other times we can really help children to regulate by showing them how to do it, to being with them in the moment when they're really irritable, they're fussy, they're angry. And instead of going, hey, you, cut it out, it's okay, I'm sitting down beside you. When I feel angry, what helps me, I stop, I slow down, I breathe, I give myself a minute just to think, what's going on here, what do I want to do? And try to demonstrate that and help the child go through that, whether it's, sometimes it's not as easy as that. But sometimes for us just to be mindful of, kids don't necessarily, teenagers don't necessarily know how to deal with really difficult feelings. And it's very difficult for us to see them in those positions. It's very distressing, as a caregiver, a parent, whoever is surrounded by that child, adult who's surrounding that child.
And I think also that idea that actually sometimes, because we're, so close to somebody, so if it's a parent, it can be very hard to actually help, somebody that you're so close to. And it's recognizing that actually, sometimes the best thing we can do for children or people closest to us is say, I acknowledge what you're feeling. I can hear it. I can see that you're upset. I recognize that there's limitations in terms of what I can actually do for you, but I'll help you get the right help to do that. And I think that's probably what I would say in terms of the most important thing for, I suppose, any of us really, but parents with children as well.
Yeah, because there can be that guilt of my child is suffering and I can't help, I don't know what to do and I should. But actually sometimes it's just, it's too hard, we're too close, and And it's not about not doing the right thing or being a bad parent at all. It is just people suffer. It's part of life. You cannot protect your children from everything. They will go through difficulties and they have to learn how to manage that.
One of the questions that came in was in terms of how would we know whether to take time off work, specifically like related to our anxiety.
I think it's likely to be different for everyone, and I think it's really important that people don't compare what I should do, what other people are doing. Our jobs are similar. I'm coping or not coping with this in comparison, because people have different things going on in life. And I think for me, if I was working with someone who, was thinking about taking time off work, it's considering, well, what's the quality of your life like right now? And if it's work specific, difficulties, the stress and anxieties to do with work, be encouraging people to go through if they have like human resources, if they have occupational support through their workplace, to have conversations if that feels doable with supervisors, managers. If that's part of the problem, then to seek support outside of that. If it's not work related and it's just life, but it's impacting your capacity to do your job, then again, having conversations, particularly with the GP, can you take a few days? You don't need a sick line. It doesn't need to be a big deal to take a few days off work to give yourself some headspace to work out what's going on here for me.
Yeah.
And if it turns out you need a bit more time than that, then you have these, you're collaborating with your GP or your health professional to work out what do you need. And, I suppose this might seem really simplistic, but life is bigger than work, and we need to really pay attention to that sometimes. You can only give out what you've got, and if your work is suffering, your family life is suffering because you don't have the resources, the energy, the drive anymore because something is happening for you, whether that's over a long time or that's just something more current, whether that's to do with COVID, and the just the impact, the draining of that on all of us. It's okay to be kind, have compassion for yourself, give yourself a break, and then work out what you need. It doesn't have to be you're making a decision now, I'm going to go off for 6 months. That might happen, but all you have to do, take a first step, break it down. It doesn't have to be a huge life event. Break it down. The first step is just having a conversation, chat with a partner, chat with a friend, chat with your GP, work out what the options are and go from there.
Yeah, and I think that's, you said there at the start about not comparing, how you're coping to other people is really, really important, because we've got no idea what's going on in other people's lives. But the thing that I would just add to that is that from my experience, sometimes people who have quite severe anxiety or severe depression, for example, maybe actually don't know themselves how to take that decision that I shouldn't be at work. And that's where it is so important that you do talk to if somebody that you trust, like a family member or a friend or a partner. And if you feel like you don't have anybody in that environment, then try and speak to the GP, because they'll sometimes help you and sometimes make that choice for you. They'll listen to you and say, actually, based on what you said, I don't think you should be at work. If you can speak to a manager, again, it very much depends on that relationship with a manager or supervisor, but if you can speak to them, sometimes we need sometimes we maybe need somebody's permission, but almost like they're going to say, we're going to almost make that choice for you. And actually we can see that right now it's in your best interest that you take some time off. And sometimes whenever somebody is so severe, I think for me, that's one of the things that I would notice is actually we sometimes need other people to step in and make that decision for us. And it's not done like in a punishing way at all. It's just actually, we can see that you're really struggling here, so let us help.
Yeah, and that's not about professionals trying to take control away from you. It's just offering, this is our opinion, and it might be really hard for you to give yourself that permission, as you say, or to give yourself that compassion, because maybe you've never done that before, and maybe you've never even thought, that it's not okay that you feel the way that you do, and to even notice that you're struggling. because we're on that automatic pilot mode so much of the time, that actually it can be massively relieving, and it can also be really difficult to have those conversations, and can be quite emotional when you have someone sitting there going, no, it's okay to take time. And that can be whether you have clinical levels of anxiety or not. If someone says that you just need a break or some time, that can be granted regardless.
Yeah.
In my experience.
And I think sometimes, even rather than sitting with that in your own mind and kind of ruminating on that, should I be taking time off work? What should I be doing? Is it okay to take time off work? Having that conversation with somebody else, even just that conversation, when you might decide, actually, no, I'm not going to take time off work. That's okay. But being able to have that conversation with somebody else rather than staying stuck with it in your own mind, I would say that's probably going to be more helpful.
Yeah, because we know that about anxiety, that thought process of going round and round the houses, and you're trying to look at it, examine it from every single angle, and know what the outcomes might be. And the fact of the matter is, we don't know until we actually move towards the situation. We can try and prepare as much as possible, but one of the issues with anxiety is constant worrying and not actually, getting the follow through of the action, or worrying for such a long time. And I think there was maybe questions about how do we treat that.
The question came in, what is social anxiety, and kind of how would we explain it to people, or how would we describe it? And we've talked a little bit about that in terms of that. What makes it different in terms of from the more generalized is that it is related to those more social settings in terms of having to meet other people, being around other people, and things like that. So that for me is that main. That would be the main difference. But I suppose, have you got any thoughts on what particularly makes it different from the other ones?
Yeah, so social anxiety, which I think it technically comes under phobia, really, in the, when we're classifying it, because it's so specific to social situations, tends to be around. Yeah, I would be likely picking it up if we're identifying someone's got a fear of being judged, excessive worrying about going into social situations like gatherings or parties with other people, which can be a very common, fear, anxiety provoking situation for many of us. What will I say? What will I do? But for people with that, clinical levels of sort of that anxiety, there's a real fear of, so it's kind of like the worst thing you could ever think of is that I'm going to be in this situation and I'm going to be made to look stupid. I'm going to be embarrassed. People are going to see that I'm embarrassed. You will likely blush. You will likely shake. You will likely either feel or be sick. In advance of these scenarios or during them. Similarly, in terms of bowel problems, I think generally it's around the fear of that. You'll have fear of it rather than actually happening, but it certainly can. And I suppose it's just this belief that something dreadful is going to happen to me, and I'm not going to be able to live with it. People are going to talk to me in a certain way or view me in a certain way, and that's just not okay. And I guess we would view that as excessive to what someone might be worried about, getting a bit embarrassed or saying the wrong thing. But other people will actually, physically, that's the worst possible thing that could ever happen to me, and I cannot cope with that. And will lead to them being highly avoidant of social situations, might become very reclusive. As you said, not respond to messages, not go out alone. And I suppose generally when we're thinking about how to intervene with that, we're talking about sometimes social skills training, we're talking about sometimes exposure-based activities to build somebody up to doing the sort of feared interactions that are there for them. which are very much taken in a stepped approach, and that's very important. And things like relaxation training to help you to cope. Essentially, is putting people in situations that they fear to show them that the worst case scenario likely is not going to happen. And again, as we said, if it does, then you're able to cope with that. And again, there's something about often separating or having an understanding of why is that there for you? Is it predisposed because awful things happened to you in the past? And these things actually did happen to you. It's not just a fear. You've been embarrassed, you've been humiliated, X, Y, Z, and in your head that's likely to happen again. And it's really important when we're doing intervening that we're looking at, okay, well, who's actually in your life? Are these people that did this to you in your life, or are they not anymore? Or have you taken that scenario and we've made it cover everything else? It's generalized out. We're expecting the worst from everybody. All humans are like this. Is that actually a fact, or is that just your opinion? What's the potential versus the possibility that the worst case scenarios are actually going to happen, and we go through different cognitive strategies to really evaluate what's going on here for people, to take them through that process.
Mm-hmm. Mm-hmm. Yeah, and I think in terms of that kind of treatment of it, I suppose it very much depends on how severe that social anxiety is. If that's what I would be thinking. Like there's an awful lot, and it's great that we have access to a lot of good resources online in terms of trying to do some self-help related to that. And if you've got quite kind of mild to moderate maybe, or maybe on more on the milder side in terms of that social anxiety, then that self-help material might be enough to help you. There's some really good workbooks which like again those workbooks from the Centre of Clinical Interventions, really good, help you go through, do some of those cognitive strategies that you're talking about there in terms of evaluating, what's the likelihood of that, the things that I'm thinking will come true versus not. And it's quite a structured way to work through it, and they are intended to be self-help material. And what I would say is if you kind of, if you engage with something like that and it's helpful, then that's great. But for some people that might not be, and then that's the point at which we would say, okay, well then again, go back to your GP or speak to a psychologist, a counsellor, whatever it is, to try and get a bit of extra support with that, because that might be what you needed in terms of, and sometimes we all need that in terms of being able to understand it. And it's that two parts that you said there, that like understanding, well, how did I get here, what happened, is there something that has happened to me that has led to this, or am I just predisposed to this? And then, okay, well, now that I know that, how do I deal with it going forward? And that, as I said, might be through self-help if it's more milder, but if it's more severe, then you might need more professional kind of support to help you with that. I think that for me is the kind of the only thing I'd add in terms of that kind of the best treatment for it. And there are, I suppose some people would argue very strongly for like CBT for social anxiety, and certainly that might be true for a lot of people in terms of its efficacy, but there are other people who will respond really well to other types of therapy for social anxiety as well. And it's very much about finding what works for you. And that's been a theme throughout all of the episodes in the podcast, is that sense of like, yes, CBT is probably what's recommended, but if you try it and it doesn't work, there's other ones there, as well.
Absolutely, because there's lots of different theories, and CBT has got a great evidence base, but sometimes it works for people more than others, and who you're working with can have an impact on that as well. And and for some people it's just that it's doing that self-esteem based work, it's being in a relationship or a professional relationship with someone that it builds you up, that someone sees you differently from how you've been seen before. And sometimes we do need to take a look at, who am I surrounded by? Who makes me feel good, and who makes me feel not good about myself? And what are my boundaries in relationships? how do all these different elements impact my, if I'm, really geared up and on edge when I'm around different people, or I feel comfortable.
Yeah.
Is that just about me, or is that about other people?
Mm-hmm.
Because often we blame ourselves and we think, oh, it's my fault, there's something wrong with me because I'm like this. I can't get my heart rate down. I'm almost at a stage of panic when I'm engaging with people, but that can often be because of who we've been surrounded by, or just not feeling good around different people.
Yeah. I think if we can kind of tie in those two questions together in terms of the best treatment for social anxiety, and then the other question that had come in was in relation to kind of, the steps that you would take in terms of dealing with it when you feel anxious. I suppose maybe just I'm mindful of the fact that even there in our conversation, we've said things like, different like cognitive techniques or exposure kind of therapy, but a lot of people might not know what that is, and I suppose I'm trying to break it down in my own head here as I'm thinking in terms of the kind of the steps or the stages for me would maybe be things like what we call psychoeducation, which is helping somebody understand, when you're feeling anxious physically, like understanding, well, what's happening in your body. So those things like those kind of fight or flight responses, that idea that, your muscles your blood's going to your muscles, getting you ready to run. So it's not going to your stomach. So your digestive system isn't working. So that's why you might feel sick. That's sort of psychoeducation around helping people understand this is what is happening. And that's really important. So that's one of the kind of steps in terms of the treatment, and that's one way of doing it. Psychoeducation is also that what you said there in terms of that, looking at the relationships with the people who are in your life and the boundaries that you have with them and who makes you feel good and not good. And if we look at, commonly for social anxiety, I suppose that idea that exposure therapy is often, what's used, and just to help people kind of understand that a little bit, that it's actually it's not about us saying like, okay, well, we know you're anxious about a situation and, you've gone off to university, so let's go to every single, invitation that you get for everything that's happening during Freshers Week. And, that's not maybe going to be helpful, but about building you up slowly so that exposure work is working with the person, working with the psychologist or whoever you're working with, and agreeing like a hierarchy of situations. So it might be starting kind of small, meeting a friend for a coffee, building up then to maybe, going on a walk with somebody, going to more of like a group-based thing, so trying to sit beside somebody in class, and then going to like a party with somebody and kind of building it up in that sense. It's not about kind of overwhelming you.
And we take, smallest details of what time of day is it, who else is likely to be around, bring someone with you that you do feel comfortable with, allow yourself to have some sort of a kind of structure, but having something that will help you get through it. This isn't about making you feel horrendous. This is about building confidence to face fears, and there will be anxiety around it, there will be increased distress around it, but the idea is that we do it in a manner that feels manageable. I think what I always say to people, I wouldn't ask you to do something that I wouldn't do myself if I had the same difficulty or haven't been through myself. And, we know that you can do it. It's scary, but we'll help you to structure it so that you can. We don't want this not to work. We want it to work with you so that you feel better, your well-being improves. That's our goal always, is your best interest. So, it's about having that trust between with each other. We're doing something to help you.
I think for me, that's the benefit of doing it with somebody, is that, you sit down and you figure out, okay, what, realistically, what do I think I could try to do between now and next week, and really getting into, as you said there, like the time of day, who's going to be around. Let's visualize that situation and what's going to happen, and let's really talk it out and get, and help you with it. And also, that idea of like, let's try it. I always say to people, let's try it. Let's see what happens. And if it doesn't work, that's okay. It's not about me going, oh, we didn't do the thing that we set up. It's not about that. It's about going, okay, well, what happened that made it difficult, and how do we help you with that then?
Wow.
And not doing it on your own. Because although I know, as I said, like there's loads of self-help material out there, and I think that's a great thing. But for somebody who's got more like severe social anxiety, when they try to do those things, then it's too much to do on their own. And so then there can be that sense of, well, I tried that and it doesn't work. And actually, sometimes the beauty of working, but in my experience working with somebody else, is that actually it allows you, that person, to help you get a sense of like what level you can actually manage right now. Because often what we see is that people try to do something, but they go like for the thing that's the scariest first, and then they get disheartened when they can't do it. And we're like, well, that's okay. Let's manage our expectations around that. Let's bring it down to something that, in building your confidence, exactly like you said, and your ability to cope with it. So I suppose I don't want to say it's a long process, because I think it very much depends on how somebody's social anxiety is. Like, but there are certainly steps there that can be taken in terms of managing it and kind of, treating it and things like that. So it's about recognizing it first, going to the GP, speaking to somebody then, and working collaboratively with somebody to figure out how is it working for you. Yeah. We can only talk about this so much, but for everybody, their experiences of it is going to be so unique and so different. If you give me 10 clients that all have social anxiety, I wouldn't be doing the same thing with them all. There would be different parts of it. So I think that's important kind of to recognize. The other question then was recommendations or steps for when you're feeling anxious about an upcoming event, or if there's kind of something that you want to do but you're having those kind of racing thoughts. And I think that, I suppose that ties in a lot with what we've kind of said in terms of it's working with somebody. If it's something that's chronic for you and you see repeatedly, and I would always say then, if I'm working with somebody with social anxiety, it's not that our end goal is that they'll never feel anxious, because that's not a realistic end goal. But what we do is go, okay, what do we think will be the potential triggers beyond our therapy, and how will you manage those? So using the therapy as it's giving you skills to then take with you when you're going to those situations. And for me, that applies across not just social anxiety, any of the kind of any of the anxiety disorders, is that idea that, I suppose I was thinking whenever I was talking about this, whenever somebody had asked for like steps or recommendations for things that you do, we hear mindfulness so much, like you should try mindfulness when you're anxious. And I think mindfulness is great, but I don't know how great it is when you're anxious and you've got racing thoughts and you're about to go out the door to a social event. I'm not sure then that, putting on a mindfulness exercise is going to be any good to you.
And I think that's a really important point, and it brings in the idea of expectations as well. It's that if you notice that these are consistent difficulties for you, what you need to be doing is working every day when you're not feeling that high level of anxiety. You're needing to be doing relaxation exercises. You're needing to be being aware of, how do I feel right now? How is my body? What do I know that I feel when I am more anxious? And how can I notice the difference? So right now I'm feeling relatively relaxed, grounded. I'm just hanging out in my house or whatnot. But I know that, maybe tomorrow night I said I would do that thing with a friend, and I know that I will feel really uncomfortable then. So for whatever reason. And so, to help me to try to get back to a more state of sort of relaxation, what can I do? I can practice deep breathing. I can be noticing, how are my thoughts going through my head right now? What have I got under the microscope before I'm going out to meet this person? What am I looking at in such an excruciating amount of detail that it's, well, of course, make you feel worse, because you're examining that, all the what ifs, all the worst case, and that can be helpful to a point, but we need to boundary it. We need to go, right, I'm going to have 15 minutes of worrying about this, and then I'm going to kind of, as best as I can, put it away and know that I have done my best possible worrying about this. I did it at a time of day that I was clear-headed, I was thinking it through, I've done my best possible worrying. There's no other potential outcomes for this. I know that I've done that, and let that, just sit there in that special place, and go back to your breathing. Let the thoughts just pass through your mind rather than focusing, zooming in, putting them under the microscope. And there's loads of these mindfulness exercises, but it is a skill and you have to practice it regularly to get the main benefit of it. So, there's loads of great apps out there that help us with, to prompt us to do breathing daily, to prompt us to do the mindfulness daily, to prompt us to go through, different examinings of outcomes that can help us think about, what's the most likely thing or what's not likely, and get us a more balanced place so that we're not always evaluating the worst. But I think it's about consistency, so that when you're in that place of, feeling the worst, you can access more readily the skill set of bringing your physiology down, soothing your nervous system, which you can predict is going to be distressed, and allowing yourself to use the skills that you're learning, you're using every day to bring that back down, and to help you, so that every single time you put yourself in that position, you're going to feel a little bit less anxious, a little bit less worried, and just helps you to do that more consistently.
Yeah. And I think it's that range of skills, like, we've said like mindfulness is helpful, but you have to build it up. It's like a muscle. You have to, you can't just put on a mindfulness exercise the night before you're due to do something that you're really anxious about and expect that it's going to, help, because it's not. So using it regularly to keep like your general anxiety level down, to help you be more connected with how you feel, so that then it's like, okay, for the past 3 months, every day I've been doing this exercise and I know that I feel more relaxed when I do it. So then there's a stressful event comes up, so our body knows that when we do this thing, it's more relaxed, so let's do it again. So using it in that way, it's about being smart as well about those kind of things. Or sometimes with anxiety, I think it's something that struck me recently, is that idea that people are very anxious. And one of the things that has come up for me a few times is that idea that people are very anxious before they go to bed, so they put on a mindfulness exercise and they lie in the bed listening to this exercise, while actually there's so much adrenaline pumping through their body, and it's that expectation of, well, what can how would you expect that to help in that moment? And we don't slow it down enough to think about these things, so that's not a critical thing. It's just something that I've noticed. And actually, saying to somebody, if you think of that anxiety as a lot of energy that's running through your body, or you think of it like a young child who's got loads of energy, the last thing that young child's going to want to do is go to sleep. So we need to find a way of burning that energy off, and mindfulness is not going to help us burn that energy off. So whether that's, getting up and walking around a little bit to expend some of that energy, and then whenever you feel calmer, using the mindfulness exercise. But to me, that's again where that, using the therapy to help you identify in these different situations that make me anxious, what can I do? So the night before I might use more kind of cognitive skills in terms of exactly what you said there, that allocating a certain amount of time for worrying, or I might do kind of a thought diary, and what's the evidence for and against these worst things that I'm predicting going to happen. It's better to do that the night before the thing than just as you're going out the door to go, because you're going to be too anxious to think about it. So using those different techniques at different times, and then just before you go out the door, using those kind of breathing exercises that you've been practicing would be more helpful. So it's getting kind of, it's almost having to learn, when do I use these different tools and how do I use them best? And that's it's not easy to figure out on your own, I think.
And I think it's going on a bit of a tangent, but it's something that's often really associated with anxiety, is that not being able to sleep, which you just brought up, that insomnia experience, or even if it's not insomnia, just difficulty going to sleep, having broken sleep, not feeling rested. And, there are very specific, often really short-term interventions for things around sleep that can be really helpful. And, trying to go to sleep when you're not tired, let's stop doing that, because it's not helpful. Don't be in bed unless you're sleepy and you're going to sleep. Bed is sex and sleep, nothing else. Not mindfulness, do it on the sofa next door. Because bed, needs to be associated. We don't want it to be associated with feeling awful and thinking that I can't get to sleep. I need to get up, and my alarm's set for this time. I've got 5, 4, 3 hours left. All these things are associating bed with just being in a horrible place, and we don't want that with the bedroom calm and relaxed. And that's, I think, really difficult right now because of COVID, because a lot of people are working out their bedrooms, and that can't necessarily be helped. But maybe even trying to, have another space, doing it at the other end of the bed, or, having a chair or a desk somewhere if you can possibly, and trying to separate out, if you do have sleep difficulties, consistency and routine, trying to keep bed as far as possible just for sleeper sex.
I think that's a good point as well, because you're right. I think a lot of people who have anxiety, their sleep is so badly affected, and so we can also target those kind of specific things, and try and do a bit of work specifically on the sleep, keeping it in the bigger picture of that there's anxiety happening here, but kind of focusing on that. Thank you very much for actually, having this conversation. And I think the more we talk about it, the more we're both looking at each other, being like, God, we can talk about so many other things.
There's so much to it.
But it's really good to have an opportunity to chat about that. Hopefully that answers questions that people have. And as I said, maybe it's something we can come back to in terms of getting more specific episodes around specific things. But just to say thank you very much for your time.
Thank you so much for having me. And I'm sure there's lots of things we covered and lots of things we didn't. But hopefully we've done the best we can at this time. And if there's other things, then I'm sure we'll come back to them. But thank you so much. I really appreciate the opportunity. It's been great to have this chat.